Hi, I am Sylvia Azania, and in this video, we are going to talk about the reasons for taking contraceptives prior to an IVF and the duration required. Additionally, we will answer the most frequently asked questions users may have related to this topic. There are occasions in which the gynecologist prescribes oral birth control pills to the women before beginning ovarian stimulation for an in vitro fertilization cycle or IVF. This usually tends to surprise the woman because an IVF is an assisted reproduction treatment that is performed precisely in order to try to achieve a pregnancy. Oral contraceptives typically contain estrogen and progesterone, meaning they are combined. Both of these hormones are very important in regulating the woman's menstrual cycle. For this reason, when the oral contraceptives are administered exogenously, the specialist has greater control over it. Therefore, the gynecologist may decide to prescribe oral contraceptives before an IVF cycle for reasons such as the following: to regulate the onset of menstruation for patients who experience an irregular menstrual cycle, to inhibit ovarian function so that the ovaries are at rest at the beginning of ovarian stimulation. For example, in the event that any persistent follicles or follicular cysts are observed, and also in order to avoid synchrony in follicular development during ovarian stimulation, which could affect the results. And also in order to facilitate the scheduling of important dates in assisted reproduction treatment for those specific patients who require a much more level of planning. The specialist will assess whether taking oral contraceptives prior to the IVF cycle is the most indicated course of action. Due to this, contraceptives are not prescribed to every woman who is about to begin an IVF cycle, but rather when it is deemed suitable for the patient's specific circumstances. And before continuing with the content of this video, I'm going to ask you to please like it if you're enjoying it and subscribe to the channel if you haven't already, as this helps us enormously to continue and ensures that all the information we publish reaches more people. If the specialist prescribes the patient to take oral contraceptives before an IVF, since they are not necessary in all cases, the usual practice is to start taking them in the first days of menstruation, from the first to the third day after an ultrasound check. In the same way, it is most common to take them for about 2 weeks, although the specific situation will dictate the exact duration. After this period of approximately 15 days on contraceptives, the specialist will confirm via an ultrasound and/or a hormone analysis that the ovaries are inactive. In this scenario, the woman will discontinue the contraceptive, and after a rest period of around 5 days, she can commence the designated ovarian stimulation protocol. Nevertheless, it is crucial to always adhere to the instructions provided by the specialist, since they possess the best understanding of the patient's specific condition. And if you want to read more information about the entire ovarian stimulation process, I recommend you access the article I leave for you in the tags. And now, we will address the most common questions that users might have concerning this subject. Is it common to use a hormonal contraceptive other than the pill before an IVF? If the medical specialist considers that it is truly necessary to take contraceptives before the beginning of the ovarian stimulation for a cycle of in vitro fertilization or IVF, the most common option is the use of oral contraceptives, that is to say, the contraceptive pill, although other types of hormonal contraceptives such as the vaginal ring or the contraceptive patch could also be used. What happens if I need to take antibiotics while taking contraceptive pills before IVF? For the majority of antibiotics, there is no robust scientific evidence demonstrating that they reduce the overall effect of contraceptives. However, there is one exception: the rifamycins. Consequently, the primary advice is to notify the medical team that is managing the assisted reproduction treatment that you are currently taking an antibiotic. The specialist will carefully assess the circumstances and determine the optimal time to commence the assisted reproduction treatment. Are contraceptives administered before IVF with donor eggs? Yes, it is possible that the gynecologist prescribes oral contraceptives to the recipient woman before starting an IVF with donor eggs or egg donation, especially in the case that it is a fresh egg donation. The reason for scheduling contraceptives is that in this case, it is necessary to synchronize the recipient's menstrual cycle with that of the donor. That is why it is common to take a contraceptive, which will facilitate that coordination. Subsequently, the donor will begin ovarian stimulation, while at the very same time, the recipient will start endometrial preparation. Thus, the recipient woman's uterus will be ready on the day of the embryo transfer. We would really love to hear about your experience, so I encourage you to share it in the comments. And I remind you that in the description you have the link to an article where you can read much more information related to this topic.